Hey everyone, welcome back to my YouTube channel. Today I want to dive into two of the biggest questions I get in my Bill Like a Boss membership. The membership is for therapists that are learning how to bill insurance on their own, or virtual assistants who are trying to learn how to help therapists bill insurance in their private practices. So two of the biggest questions I've been getting lately is, how do I bill for prolonged sessions? And how do I bill for paperwork or case management? So I want to do a video and just let you know some updates in 2023 that have happened related to both of these topics. So let's start with prolonged services, a critical area for therapists seeking reimbursement for client contact that goes beyond our typical session time, which would be a 90837 for most therapists. So before 2023, the CPT codes 99354 and 99355 were commonly used for outpatient psychotherapy services. However, the deletion of these codes early this year posed a real challenge for therapists who use them for trauma-related services that required 90 minutes or more, like EMDR. Fortunately, there is some good news. The National Association of Social Workers and other mental health associations managed to advocate to find solutions for this problem that we were all facing. So according to the NASW, can now report 2 units of 90834, each standing for individual psychotherapy for a 45-minute session, totaling 90 minutes on the CMS 1500 form. So if a session needs to be extended due to a crisis, then the psychotherapy crisis codes 90839 and 90840 should be used. But if it's not a crisis and you're trying to do a 90-minute session, this is a new solution to 90834s on the same claim form for the same data service. This is amazing. This is new information. It's not going to work for everybody, but I want you to keep your eyes out, check with your commercial insurance payers, and see if this is an acceptable combination of codes for you to get paid for, especially if you're an EMDR therapist or someone who is traditionally trying to do 90-minute sessions with your clients. And there's recently been another important update around this code G2212. Blue Cross Blue Shield in Michigan was the first to approve this. They've recommended that you can use G2212. This code represents a prolonged office or other outpatient evaluation and management service, and it can be billed in 15-minute increments. So it used to be an E&M code only, but now it's been approved for clinical social workers and other therapists that want to try to extend their sessions. So starting from January 2023, practices have started using this code to replace the previous 90837 plus 99354 combination for billing 90-minute EMDR processing sessions, or just having a 90-minute session for whatever reason. Now, for a 90-minute session, you could bill 90837 plus 2 units of 15 minutes of G2212. These are interesting developments and they are being used, but it's not going to work for every payer. So I just want you to be super aware of that. Next up, I want to decipher the most recent changes from the CMS document on the physician fee schedule, payment for office outpatient evaluation and management EM visits. So it highlights significant CMS changes aimed at reducing administrative burdens. So this is a big deal. This is a question I get all the time. How do I bill for consultations? How do I bill for paperwork? So the behavioral health integration services in 2023, CMS approved several codes for use by clinical social workers for behavioral health integration services. So BHI is a program designed to integrate mental health services with primary care, aiming to reach the population that often hesitates to seek mental health services. So now the codes that have been approved are code CPT 99484. This code covers care management services for behavioral health conditions with a minimum of 20 minutes of clinical staff time directed by a physician or other qualified mental health professional per calendar month. So you have to see them for at least 20 minutes face-to-face or over telehealth for at least 20 minutes per month. And then there's code HCPCS code G0323. This code refers to care management services for behavioral health conditions with at least 20 minutes of clinical psychologist or clinical social worker time per calendar month. So these services could include like initial assessments or follow-up monitoring, or even like the MDQ or a rating scale, one of those many rating scales that you can use with clients to monitor their mental health and their progress. Billing for these services requires meeting specific criteria by CMS, including certified EHR technology, spending 20 minutes of non-face-to-face time per month, documenting the time spent per client, and enabling continuity of care with a designated care team of members. So Medicare also allows patients to enroll in both its chronic care and behavioral health programs concurrently. When billing for both BHI and chronic care management, it's necessary to record that 20 minutes of independent service for each client. And then there's code G0511. This code applies specifically to rural health clinics or federally qualified health centers. It covers general care management with 20 minutes or more of clinical staff time for chronic care management services or behavioral health integration services directed by a practitioner from these facilities. And that's per every calendar month. Then there is HCPCS code H0004, which pertains to behavioral health counseling and therapy and is billed in 15-minute intervals. This code is used to bill for these services in healthcare settings. It is a valid code for the year 2023. The HCPCS Healthcare Common Procedure Coding System is a collection of codes that represent procedures, supplies, products, services, which may be provided to Medicare beneficiaries and individuals enrolled in private health insurance programs. So the HCPCS type of service code is an indicator that the contractor places on the CMS 1500 form. And while it's mainly used for data purposes in some instances, it can affect payments. So H0004 is just one of the many codes used in the realm of behavioral health. These codes can be used to bill for BHI services, including care planning, facilitating, and coordinating behavioral health treatment, which is huge. That's basically case management. And you can use this code if you've seen your client for at least 20 minutes per month. You can use this code for case management. A critical point to remember with all of this is the use of these codes depends on their inclusion in your insurance contract. So it's essential to make sure these codes are in your contract agreements with third-party payers before you try to use them. So thoroughly review your contracts and consult with third-party payers, consult with provider relations at the insurance companies or your network manager, or even credentialing itself. You can call and ask about that or having things added to your contract. So in conclusion, it's really important to understand these codes and keep abreast of the changes. It's really key to accurate billing and proper reimbursement for your services. So these are options. Check your contracts. See if these numbers are in your contracts. You may be able to bill for case management. You may be able to bill for extended sessions using these different combinations that I discussed today. I hope that helps. Let me know if you have any questions. Let me know if you tried to use these codes and if you've gotten paid for them. Would love to hear that. Feel free to comment below the video and let others know too which insurance company and which state you're in. That will help everybody stay informed and up to date and be able to increase their revenue based on better billing practices.